Why are asymptomatic pituitary microadenomas so common? Imagine a tiny tumor the size of a sesame seed nestled in the pituitary gland at the base of your brain. These small growths are surprisingly common, but most people never know they have them. The reason is that many of these tumors are slow-growing, benign, and cause no noticeable symptoms. They often stay hidden throughout a person's life and are only discovered by accident during brain scans done for other reasons. Research shows that up to 20% of people might have these microadenomas without even realizing it. This high number comes from studies involving autopsies and imaging tests. Many of these tumors are smaller than 10 millimeters, which is less than half an inch. Because they are so tiny, they usually do not press on nearby structures or disrupt hormone production enough to cause symptoms. One key factor is that pituitary microadenomas grow very slowly. They are benign tumors, meaning they do not spread or become cancerous. Their slow growth means they rarely cause problems like headaches, vision issues, or hormonal imbalances that would lead someone to seek medical help. Instead, they quietly exist without affecting daily life. Most of these tumors are found incidentally when people get magnetic resonance imaging scans for other health concerns. For example, if someone has a headache or a head injury and gets an MRI, a small pituitary tumor might be spotted. Since these microadenomas often do not produce excess hormones, they usually do not cause symptoms related to hormone imbalance. There are no clear environmental or lifestyle factors linked to these tumors. A small number are associated with rare genetic conditions like multiple endocrine neoplasia type 1, but most happen randomly without a known cause. This randomness contributes to how common they are but also how silent they tend to remain. Some microadenomas do secrete hormones, but often at levels too low to cause symptoms. Others are non-functioning, meaning they do not produce hormones at all. This variability explains why many microadenomas go unnoticed and untreated. They are simply too small and inactive to impact health in any obvious way. As imaging technology improves and doctors become more aware, more of these tiny tumors are being detected. This increase in diagnosis reflects better detection methods rather than a true rise in tumor formation. Most microadenomas are harmless and requiring only monitoring over time. They rarely grow or cause problems, so treatment is usually not necessary unless they show signs of growth or hormonal activity. In summary, asymptomatic pituitary microadenomas are very common because they are small, slow-growing, and benign. They often do not produce symptoms or hormonal issues, which is why many people are unaware of their presence. Their frequent discovery on brain scans is more about advanced imaging and careful observation than about disease. Understanding this helps prevent unnecessary worry and emphasizes that most of these tiny tumors are harmless. If you ever have concerns about brain health or discover a pituitary tumor, always consult a healthcare professional for personalized advice and appropriate monitoring.